Today, we're going to talk about a truly remarkable and honestly life-altering surgery called augmentation cystoplasty. This isn't just a minor fix, it's a complex operation that literally rebuilds a part of the human body to solve a very, very dangerous problem deep inside the urinary system.
So here's our game plan. First, we're going to unpack the core problem, why this surgery is even necessary. Then, we'll introduce the procedure itself. We'll get into the nuts and bolts of how it actually works, then explore what life is really like for patients afterward. And finally, we'll see how doctors can tell if it's a long-term success.
Okay, so why would anyone possibly need such a major operation? Well, it all boils down to one simple, dangerous thing: pressure.
You see, your lower urinary tract is designed to be a low-pressure system. Think of your bladder like a soft, flexible water balloon. It's supposed to fill up and store urine without putting any stress on the rest of your body, especially not on your kidneys. It's a safe zone.
But it turns out a whole host of things can wreck this delicate system. Neurological issues like spina bifida or a spinal cord injury, inflammation from something like radiation therapy, or even complications from other surgeries. Any of these can cause that flexible bladder to become stiff, small, and just unyielding. It completely loses its stretch.
And that stiffness leads us to the real villain of our story: high pressure. Once the pressure inside that bladder climbs above this critical number, 40 centimeters of water, it starts to do something terrifying. It pushes urine backwards, up towards the kidneys. This back pressure can cause permanent, irreversible damage, and ultimately, kidney failure. This right here, this is the danger zone. This is the point where doctors have to consider a drastic intervention.
So how do you fight back against that kind of dangerous pressure? Well, this is where augmentation cystoplasty, or AC for short, enters the picture. It is a powerful, last-resort surgical solution designed for this exact problem.
And the goal of the surgery couldn't be clearer. You're taking a small, tight, high-pressure bladder that's actively threatening the kidneys, and you're transforming it. The whole point is to create a brand new, high-capacity, low-pressure reservoir that can safely store urine and, most importantly, protect those kidneys.
So who actually gets this surgery? Well, it's definitely not a first-line treatment. No way. This is reserved for patients who've already tried everything else, medications, other therapies, and nothing has worked. They're the ones with those dangerously high bladder pressures or severe incontinence, or the ones who already have clear signs their kidneys are taking a beating.
But here it is. This is the single biggest, most important factor. This procedure is absolutely 100% off the table for anyone who can't commit to a strict, lifelong schedule of what's called clean intermittent catheterization, or CIC. This means using a small tube to empty the new bladder on a set schedule multiple times a day, every single day for the rest of their life. You have to understand this isn't just a surgery, it's a complete change in how you manage your body forever.
So how in the world do surgeons actually do this? How do they remodel such a vital organ? The mechanics of it are just fascinating.
At its core, the idea is kinda simple but totally profound. A surgeon literally takes a piece of the patient's own bowel, usually from the small intestine, and uses it like a patch to make the bladder bigger. It's like adding an extension onto a house. This instantly increases its volume.
And a few key innovations are what really turn this from a risky experiment into a life-saving solution. First, surgeons figured out how to detubularize the bowel. They cut the tube-shaped piece of intestine open and flatten it out into a sheet. This is genius because it disrupts the bowel's natural urge to contract and it maximizes the space. Second, CIC, which we just talked about, was the game changer for emptying the new bladder. And finally, for patients who can't use their urethra, surgeons learned to create these little surgical openings on the abdomen called stomas for easier catheter access. And they developed ways to strengthen the bladder's outlet to prevent leaks.
All right, so the surgery's over, the patient wakes up. What's the new reality? What does life actually look like now?
You know, for the right person, the results are nothing short of life-changing. As the source material says, it's an outstanding option. It literally saves the kidneys from failing and can completely resolve debilitating incontinence. We're talking about a dramatic improvement in quality of life.
But, and this is a huge but, this is not a perfect cure, not by a long shot. Because that new patch is made of intestinal tissue, it brings a whole new set of lifelong risks. That bowel tissue can actually absorb things from the urine, leading to metabolic problems. There's a higher risk of cancer developing right where the patch is sewn on.
and the mucus that the bowel tissue naturally produces can lead to bladder stones, or even worse, a spontaneous rupture of the bladder if it's not emptied properly and regularly.
And this number, this right here, really drives home the long-term commitment. Almost half of all patients who get this surgery will need another operation at some point down the road. The initial surgery is often just step one in what can be a very long journey of surgical care.
So with such a high chance of complications, how do doctors even keep track of everything? How do they measure success and figure out what's going wrong when a problem pops up? Well, right after the surgery, the results are usually dramatic. I mean, look at this. This chart shows that after surgery, the average bladder capacity more than doubled. But more importantly, look at the pressure. It plummeted from a dangerous 49, way above that 40 danger zone, all the way down to a super safe 16. So on paper, mechanically, it's a huge success. But what about years later? What happens if a patient starts leaking again? This is where a diagnostic tool called urodynamics becomes absolutely critical. Let's look at a couple of real-world cases to see how it works.
Okay, in this first case, focus on that green line on the chart. That's tracking the bladder pressure. See how as the bladder fills up, that green line just climbs and climbs? That's what doctors call a loss of compliance. It means the new augmented bladder has gotten stiff again over time. And in this case, the only solution was another surgery, a re-augmentation to add another patch.
But now, look at this second case. It's a completely different story. On the chart to the left, that green pressure line stays nice and low and flat. The little spikes you see, that's just the patient coughing, and that's when they leak. Then you look at the x-ray on the right, and it confirms it. You can actually see urine leaking out from the bottom. The problem wasn't the patch at all. It was a weak sphincter, an incompetent outlet, which needed a totally different kind of surgical fix.
So let's just boil this all down. What are the big takeaways here? Augmentation cystoplasty is a powerful, last-ditch effort that absolutely saves kidneys. It does an amazing job of creating a large, low-pressure bladder. But, and you have to remember this, it is not a cure. It demands a lifelong, non-negotiable commitment to catheterization, and it requires constant, vigilant, long-term monitoring to manage the very real risk of future problems. And that leaves us with this one final, fascinating question. For over 100 years, this has been the ultimate answer to this problem. But now, as new therapies like Botox injections and other technologies get better and better, you have to wonder, will this incredible feat of surgical reconstruction stay the gold standard forever? Or will we one day look back on it as a relic of medical history?